Okay. Okay, so we're gonna start now. So, Assalamualaikum and a very good morning, Doctor.
Waalaikumsalam warahmatullahi wabarakatuh.
So, first of all, thank you so much for taking the time to join us today. So, we really appreciate the opportunity to learn more about doctor, about a pediatric doctor. So, let us introduce ourselves first. So, my name is Daniel and my partner is Farah. So, we are students from College Marakulim.
Alright. Yes, thank you again for agreeing to be part of these conversations. And as Asfar mentioned, this interview is part of our English assignment. So where we explore different aspects of medical careers, and through these conversations, we hope to learn about the journey in becoming a pediatrician. So with that said, Doctor, we would like to dive into the interview with our first questions, which is Asfar will start.
Okay. So to begin, Doctor, could you please introduce yourself and tell us about your story to become a pediatrician?
Okay. First of all, thank you very much for inviting me to be the host today. I'm Dr. Firdaus from Metro Specialist Hospital. I've been a consultant pediatrician, and I've been in this medical field for the past, more than 15 years old already.
Yes.
And then if you're asking me the specific detail about why or how I get this special interest in becoming pediatric, it's all started after I become houseman. Actually, during my medical student time, I didn't have any special interest yet because it has been very vast, either in surgical department or medical department or even radiological department. But once I enter pediatric department as my first posting in housemanship, I noticed that the feeling of the smile and then the empathy that can be shown by children actually are very honest. And then adults usually they can evade our question as well, but for pediatric they are very honest, they are very naive. And then of course the smile you get when they are better, so that actually drew me into the field of pediatrics.
Thank you for sharing that with us, Doctor. And since pediatric focuses on such important stage of life, which is the children, we are curious to know what first inspired you to pursue this particular field of medicine. What is your purpose?
So as mentioned earlier, usually what I see in pediatrics, most of the cases, fortunately in pediatric, they are getting better after they have been treated well. Unlike adult, usually if let's say they have diabetes, so when they are discharged, they also have diabetic as well. They are not fully recovered from it. Of course, we do have some cases of diabetic as well in pediatric. But most of the time, children, they recover well rather than adult. And then especially if we are looking at adult as well, like for example, a case of stroke, they are also not going home fully recovered. But of course, we can improve their life regardless if you're not doing pediatric as well, if you're doing medicine. Not belittling medicine, internal medicine, but of course pediatric you can have more joy in treating the patient. So that's what actually show me the way on how to like these specialties. Yes.
Okay. So basically, doctors like because we can help kids more.
Yes.
Okay. So for my next question is, what are some of the challenges you may have encountered throughout your career?
Okay, I would like to share a case. Previously, I had one patient who was admitted because of respiratory distress, and then the child was very ill. Apart from dealing with patient, because they cannot communicate well, they cannot tell you the symptoms, they cannot tell you where they are actually having the pain and the causes, unlike adults. Not only we are dealing with the patient themselves, so we have to deal with parent as well, because of course they are very concerned. Sometimes they can be overwhelmed. So the arts of communication, dealing with both sides, the patient, the parent, and of course our team as well, is very important. So I think that is the challenges as well if we are looking into the pediatric. And then sometimes they are very fretful, they don't want to talk with us. So of course these are the thing that from experience as well as from the training, so we get used to it as well. Certain friends, my colleague actually didn't choose pediatric because when you insert needle for them, or we do some procedure, they will start to cry. And then of course a lot of doctors don't want to listen or to hear the cry because they are feeling very guilt as well. Okay, did that answer your question?
Yeah.
Yes.
It must have been very stressful, doctor, and emotionally demanding as well.
Yes.
So apart from specific critical cases, we are also interested to know about the real challenges that doctors face, people don't usually see on outside.
That was a great question. A lot of people doesn't know or adapt in dealing with children. So we have to cater the needs, the emotional needs, and then how we approach them as well. Because once you approach them differently, when they start to cry, then it's gone. So you cannot get further history, and of course you need to use your observation, your intuition, as well as your clinical experience to gather all those important information from the parents as well as from the kid itself.
Okay, with that in mind, we would like to ask how you personally manage to stay focused and composed during critical situations, like during emergencies.
I think this is not only adapt to pediatrician, it also it applies to all other specialties in medicine as well. Because when we are dealing with sick patient, very ill patient, so the patient family, they want us to be composed, and then we need to be calm. So if let's say we are dealing with a patient who are very anxious, and then we also shown that through our face or our body languages, so the patient will not be calm as well. So they will be panicky as well. So our treatment will not be effective as intended. Not only dealing with the parents and the family, so you must remember our team as well, because we have a nursing team, we have other doctors as well helping us. So if we as a leader, as a doctor, we did not show calmness in that situation, of course the whole team will become very chaotic, and our intended management will not be diligently.
That makes a lot of sense, doctor.
Yeah.
And speaking about your experiences in this field, we are also curious to know about the moments that have been most meaningful or memorable throughout your career.
I think many meaningful moments in pediatric, because we are dealing with kids. So from the start, once they are admitted, let's say in the patient cases, or from the moment they step in our outpatient clinic room, so we can see the difference. Sometimes they come with very anxious, or they are very concerned, but when we tell them, or we did explain to the parent, and we try to get their little attention, their little one's attention, so they will become very happy, and then they go out smiling, and we know that we have been doing a great job in treating them. And when we see them again as outpatient the next week or the subsequent day, so they are very thankful to us. I think the word thanks, as well as their body languages of smiling, so that actually brings me joy.
Alright. So we understand it now. About lessons from career. So we're also curious about the personal lessons you may have learned through your journey in medicine. So what important lesson has your medical career taught you beyond medical knowledge?
So looking at the answer, of course, treating patient is or medicine is not all about disease. It's about connecting to patient, helping them solving the problems, and doing charity, I would say, if for us in Islam, it's a charity as well in treating patient and helping them getting better so that they can be with close family members. And then your question again, beyond, yeah. So actually this medicine, this field actually help us in dealing or learning things not only from us but also from surrounding as well, from patients, from the parent itself, and from working together as a team. Yeah, I think that is the most important thing.
Yeah, those are very valuable qualities, Doctor.
Yeah.
And considering how demanding this profession can be, we are also interested to know how doctors manage to maintain a balance between your work and also balance in your daily life.
Yeah, it's very irony if, let's say, me as a doctor's catering for pediatrics and children, but me myself didn't have time with my family. So I make sure that is the most important thing, to spend a balanced life. The key word is balance. You cannot actually spend from that 24 hours, 23 hours in the hospital and then 1 hour at home, or 23 hours at home and 1 hour at home, so you're not going to work. So you have to get that balance. Of course, I would try to make my time available for my family. So I go back on time, always go back on time. Don't wait for quite some time, because patient will not, how to say this? Of course, patient do appreciate you, but they are not around when you are in needs. Most of it will be helped by your family members. So try to spend time with family as well. So I make sure that is an important thing to do. So spend time together, of course, during work, do it 100%, show your commitment, and then when you go home, show the same commitment, the same percentage at home as well. Yeah.
Okay, so work-life balance is the key, right?
Yeah, that is the key.
So after spending time with families, so besides your clinical responsibilities in treating patients, we understand that doctors sometimes have professional duties beyond the hospital settings, right? So have you ever been required to participate in legal or court proceeding related to pediatric cases?
Touch wood. Hopefully none. So far, Alhamdulillah, I did not encounter a medical legal issue. Of course, there is near incident as well, but legally I'm not involved. So I hope keeping that until I retire.
Keeping the momentum.
Yes, inshallah.
Inshallah.
And since this is often related to protecting children's safety and well-being, we would also like to ask you about your experiences with child abuse cases and how common are child abuse cases in your clinical experience.
In fact, there are a lot of social abuse than the community knows. Not only about physical, you must remember about neglect as well as emotional abuse as well. Because of course we do see a lot of cases, especially teenagers. Of course, teenagers they will belong to the other group, specialized group in pediatric. What we call this as adolescent medicine, adolescent health as well. But we do see from time to time a lot of cases this child abuse, especially this emotional abuse, not only by close family members but by neighbors as well. And then I had a case of a stranger causing abuse, sexual abuse to a child, and of course we have to admit and treat the patient, investigate thoroughly. But luckily it has been resolved. Of course, not only doctors involved in these social abuse cases, we did involve social worker as well as authority.
So in today's digital world, children are also increasingly exposed to gadgets and technology or electronics. So, doctor, do you see more developmental delays in children related to gadget overuse?
Yes, I think that's an important question as well. Because you are going, someday you're married and get children on your own. I think gadget overuse is a worrisome trend. Of course, when we see children showing tantrum, so we will tend to give gadget to them to calm them down. But that is not the way forward. It's not the way it should be. You need to learn how to interact with your children, cater your children's, capture their interest as well, and that is a skill. It's a ongoing skill, and you need to keep learning the skill. Back to the question: if you are giving children a lot of gadget time, there is a lot of risk of the child not developing, especially on the language area and the speech area. We can see a lot of increase in the frequency or detection of what we call this as pseudo autism. It's not a real autism. It's not autism by disease itself, but it mimic the autism because of the lack of language, the lack of communication skill, so making them appear like they don't have a communication skill. Yeah, so that is a worrisome trend as well.
That's quite worrying.
Yeah.
So before we conclude our interview, we would like to ask you one final question, which is, what advice would you offer to students who are considering a future career in medicine or specifically pediatrics?
I think to be specifically pediatric, maybe you need to have that interest, and also because dealing with pediatric is a specialties in a way itself. Okay, but of course, if you're pursuing medicine,
Yes.
so I think medical career, I think do it because you really like it, not because you are forced or you are thinking of making more money, because doctors doesn't make much money, to be honest with you. If you really want to make money, I think business or something other is important. But if you're doing it because of pure interest and you are helping others to get healthier, I think that will be the joyous moment when you see them really get healthy.
Yes.
Yeah, and then like I usually tell my children, if you really love what you are working, then actually you are not working, because you are doing it out of love, out of interest, and then you enjoy every moment of it. If you're doing it because you think this is work, then it will become a burden to you. So do it purely because of your interest and your likeness of that career. I think is the end of it.
I think that's answer all of our questions.
Okay, sure.
So, Farah?
Yeah. Doctor, thank you so much for sharing your experiences and insight with us today, and listening to your journey and the different aspects of your work has really given us a clearer picture of what it really means in pediatrics. So once again, Doctor, thank you very much, Dr. Firdaus,
You're most welcome.
for taking the time to speak with us and for sharing your thoughts and experiences and also advices. And we truly appreciate your willingness to be part of this interview. And the insights you have shared today have been incredibly valuable for us.
So thank you, Doctor.
Yes,
So
thank you very much.
I think that's all of our interview sessions.
Yeah. All
Okay.
right. Thank you.
Okay.
It's my pleasure.
Thank you, Doctor.
Okay, thank you, Doctor.
Welcome.
To make our patients happy is rewarding for us.